Heart attacks are the #1 killer in the world, #1 killer in the United States. It's important to know these symptoms so you can get medical management as soon as possible and prevent heart damage. So let's talk about the symptoms. What are the symptoms if you're having a heart attack? Crushing chest pain, elephant sitting on your chest, pain radiating into the left side of the jaw, down the left arm. This is because the autonomic nervous system sensory information coming into the spinal cord at C8 through T1, they all come up into the same mixed nerve and they converge on the same sensory neurons there. And so the brain has a hard time interpreting and pinpointing where that pain's coming from. So that's why you get all of that, the arm and the jaw and the chest, just a pressure, a vice grip type of pain. You can get some autonomic nervous system symptoms too, like nausea, vomiting, diaphoresis, which is sweating. You can have some other symptoms like dyspnea, like difficulty breathing, shortness of breath. You can have low blood pressure. It's called hypotension, and that can lead to cardiac arrest if the blood pressure gets so low that it can't get perfusion to the brain and to the heart. Another symptom you can get is like cold, clammy extremities, because your blood vessels will shunt blood away from your skin and extremities and to the important organs whenever there's not enough perfusion coming out. So it kind of shunts everything to the brain and to the heart. And basically, what's the best thing you could do? Get aspirin in your system. Always keep aspirin on hand. Aspirin's cheap. You can keep it in your purse, at home. Always have it somewhere. If you start having these crushing chest pains, chew it up and let it go under your tongue sublingually to get it in your system real quick and get relief that way. So, or swallow it, just get it in your system and then get to the ER as soon as possible. Let them know you're having chest pain so they can move you up to the top of the list, because here's what aspirin does first. So aspirin is an antiplatelet medication. What happens when you're having a heart attack is you have a plaque in your coronary artery. So the arteries that take blood to your heart, they build up a plaque. And at some point, that fibrous cap around that plaque will rupture, and it's real sticky to platelets. So when it ruptures, platelets start sticking to the underlying substance, and then they start sticking to each other because they release a platelet release reaction where they just start sticking to each other. And what you do is you take aspirin, and it prevents any further development of that thrombus, that clot, from getting bigger. It won't take away what's already there, but at least you're keeping it from getting larger. And so when you get to the hospital, they'll run some tests. They'll do a blood test, and if you have high troponins and high creatine kinase MB, these are two blood markers, they know that heart cells are dying and releasing these contents into the blood. So it's important. Then they know you're having a heart attack. And then they'll do an ECG to differentiate the severity of the heart attack. So if they do an ECG and you see this elevated ST segment, it's called a STEMI, an ST elevated myocardial infarction. And so when you have these STEMIs on your 12-lead EKG on different areas where it can tell you exactly where the infarction or the dead tissue is happening, is you have full thickness ischemia, or infarction is the better word, because the cells are dying. You have cells dying throughout the whole entire wall of the heart in that area. It's called a transmural infarction, or a STEMI. And then if you don't have a STEMI, but you have it depressed and maybe this T wave is inverted, but you still have those elevated markers of cell death in your heart, then you have an NSTEMI, which is a non-ST elevated myocardial infarction. So if you have a STEMI, it's a medical emergency. You have to get to the cath lab, and most likely they'll do like a balloon angioplasty to reperfuse the heart, open up that canal, or a CABG, a coronary artery bypass graft, which is an open heart surgery using like usually the saphenous vein or mammillary artery to bypass the area where the blockage is. Or if they don't have access to that, maybe it's a rural hospital or the timing's off, they might do a thrombolytic like alteplase or rectoplase, tenecteplase, one of the tissue plasminogen activators. Those are called clot busters, and they can open up that clot. So that's with a STEMI. You have to get reperfusion to prevent further damage to the heart. If it's an NSTEMI or even unstable angina where they have the chest pain and everything, but they don't have the elevated blood markers, then they might do a stress test and do a risk stratification and decide if they want to go ahead and send them to the cath lab or whatever, or medically manage them with medications. And that's just something they'll weigh out. But keep those symptoms in mind, keep that aspirin on hand, and minimize that damage to the heart.